Hello, I am Dr. Matrish. I'm a bariatric surgeon and the director of the Weight Loss Center here at Blessing Health System. And today I'd like to educate you a little bit about weight loss surgery. First, I want to give you a little bit of information about obesity. The question is, what is obesity? Well, obesity is a lifelong, progressive, life-threatening, genetically related, costly, and multifactorial disease. And this disease is associated with excess fat storage, and it's associated with multiple other medical conditions. What is obesity? Well, the National Institute of Health uses our body mass index, or our BMI, and so depending on what your weight is and what your height is, we can calculate your BMI. Once your BMI gets above 30, then that is considered to be obese. And once it's above 35, as you can see here, it's considered severely obese. And above 40, it's morbidly obese. You are not alone. Obesity is related to over 400,000 deaths that are related to obesity every single year in the United States. It is the second leading cause of preventable death in the United States. It affects more than 100 million adults, and it affects children as well. 33% of children at this point in the US, they're either overweight or obese. And the average obese person lives 22 years fewer than someone of an average weight. What these pictures represent is the trend of obesity in the United States between the early 90s and in the 2000s. This is a nationwide issue that is affecting millions of people. And so what are the causes of obesity? Well, it is a complex, multifactorial, and complex process that involves our genetics. It also involves the environment and our behavior. As you can see from these pictures, our portion sizes have become out of control. And then the other issue is something that we refer to as the metabolic set point. This is your body's way of trying to maintain a certain weight. And so this goes back to prehistoric caveman times when food was scarce and we would try to maintain our weight because food was scarce. But our bodies have not necessarily adapted to that change. And so what happens, we gain weight, we then diet and exercise to try to lose that weight. Our bodies respond by slowing our metabolism down in order to try to maintain the weight that it wants to be. And so it's this vicious cycle, and it's very difficult to lose the weight. And so why does obesity matter? There's a 70% increase in coronary artery disease, 75% increase in stroke, a 400% increase in the rate of diabetes, and a 55% increase in mortality. There's also economic implications from your own personal cost, from food, prescriptions, medical visits, and it's a huge national cost. In the United States, obesity is related to over $200 billion in spending every year. And there are also social implications with discrimination. And so what are some of the medical complications associated with obesity? From our lungs, including sleep apnea, COPD, asthma, to our heart with heart disease, high blood pressure. It can affect fertility for women and cause things like PCOS. And the list just goes on and on. Obesity is also associated with various cancers, and this ranges from ovarian cancer to breast and thyroid cancer, liver, gallbladder, colon cancer. All of these cancers are increased when someone is obese. And so the question everyone asks is, how can I lose this weight and actually keep it off? There is medical treatment, there's diet, there's exercise. We've all tried it. Unfortunately, it just doesn't help everyone. And so what our studies have shown us is that between 95 to 97% of people who try to lose weight, they will unfortunately regain that weight. That means only about 5% of people at most, once they're more than 100 pounds overweight, will be able to actually lose the weight and actually keep it off. And this is what we, of course, term as the yo-yo effect. And so when should you consider surgery? Well, surgery is right for someone who has attempted to lose weight in the past and who's been unsuccessful and who has multiple medical issues related to their obesity. The surgical management of obesity, of course, includes a surgery, but it does also include exercise and diet and other dietary changes as well. But the difference is that surgery provides you with a new tool so that the diet and exercise can be more effective. So who qualifies for surgery? Well, anyone with a BMI greater than 40 qualifies for surgery, or if your BMI is greater than 35 and you also have other medically related conditions such as hypertension, sleep apnea, heart disease, these individuals would also qualify for bariatric surgery. You have to have tried other methods of weight loss. You also have to be healthy enough to undergo major surgery. You cannot have any alcohol or drug-related issues, and you cannot have any uncontrolled psychological issues. And you have to understand the risks of the surgery, and you have to be willing to commit yourself to a lifestyle of change. So if you are interested in weight loss surgery, there are different phases that you have to go through. In phase 1, there are multiple steps involved. The first step is either attending an information session or watching this video. So congratulations, you've done the first step. The second step is our intake assessment. During this intake assessment, we obtain your medical history and we also do a benefits check. So everyone's insurance is a little bit different. And so although we can't actually pre-certify anyone until you've gone through all of the steps and gone through the whole program, we can at least contact your insurance to ensure that your benefits will cover the various aspects of our program. Then you have to have multiple consultations. We will have you meet with our nurse practitioner. We will also have you speak with our dietitian and our mental health professional. And all these individuals will start to educate you on the process of weight loss surgery. Some individuals will need upper endoscopy or an EGD. Not everybody will need that, and we'll let you know if you do need that. Some individuals will have to see a pulmonologist or a lung doctor or a cardiologist, depending on what your various risk factors are. There will also be other laboratory studies that have to be completed. We will highly recommend that you attend one of the support groups. You will also, of course, have your visit with the surgeon, preoperative appointments, initially right before surgery to make sure that you have all the education that you need. And then we will also submit all of your information to the insurance company for pre-approval. Weight loss surgery is different from other surgery in that we really do have a team mentality. So 2 members of the team are your surgeons. Myself and Dr. Khan both perform bariatric surgery here at Blessing. You will also need to see a member of psychiatry, our mental health professionals, and they will help us determine if you have any undiagnosed or untreated psychoses. If you do have mental health issues, that's okay. We just want to make sure that you are ready for surgery and that you know what to expect. You also need to see a nutritionist. Even though the surgery is a tool and it will help you with weight loss surgery, you have to know how to use that tool, and a big component of that is seeing the dietitian. Our dietitian will educate you regarding the different dietary changes that will need to be made after surgery, and our dietitian will also help educate you on some things to do before surgery. Anyone that we're concerned may have sleep apnea will need to see a pulmonologist to get a sleep study, or if you have any other chronic lung issues. And anyone over the age of 55 or anyone with other history of having heart issues will also need to see a cardiologist. The other thing that is really important is that you have to stop smoking before surgery. This is a very important factor, and we will not perform surgery on anyone who is actively smoking. Phase 2 is the surgery. You can expect to stay in the hospital for anywhere from 1 to 2 nights. Recovery is different for everyone. Part of it will depend on your level of pain tolerance and how quickly you tolerate the post-operative diet. You can expect to be off of work for anywhere from 2 to 4 weeks, and likely will not be driving for a week or 2 as well. Phase 3 of your weight loss journey is really the rest of your life. We've given you this new tool, and then we are going to continue to educate you and teach you how to use that tool. Over the first year after weight loss surgery, we will see you a minimum of 6 times, and then following that, we will see you yearly. We also have a support group that we highly recommend. It meets on the 3rd Thursday of the month, and studies have shown over and over again that individuals who attend the weight loss support groups have a much better weight loss result after weight loss surgery. When we talk about surgery, we talk about 2 different types of surgery. One is restrictive and one is diversionary. With the restrictive type procedure, we literally restrict the amount of food that you can eat by making your stomach smaller. When we talk about diversionary procedures, we're actually rerouting your intestine to help divert some of the food as you digest it. The most common type of surgery that's performed is the vertical sleeve gastrectomy. Last year, the American Society of Metabolic and Bariatric Surgery indicates that in the United States, that over 60% of all weight loss surgeries performed were the sleeve gastrectomy. And what this entails is we remove approximately 80% of your stomach by stapling off part of your stomach. Your new stomach is about the size and shape of a banana, and this surgery works by restricting the amount of food that you can consume. It also works because your hormone levels are altered, and so your sense of hunger is also decreased. The surgery takes anywhere from about an hour and a half, and most people are in the hospital for one night after surgery. The second most common procedure that is performed in the United States is a gastric bypass. It accounts for about 30% of all weight loss surgery that's performed in the United States. And this surgery is considered a diversionary and restrictive procedure because we divide your stomach, and your new stomach is about the shape and size of an egg. So that's the restrictive part. Because of the way we do surgery, we then have to reroute your intestine so that that new stomach can drain. And so we take some of your intestine and we reroute it up to your new stomach. And so the portion that drains off of your stomach also diverts some of the food away from the intestine that is helping you to digest and absorb your food. One other common surgery that's performed in the United States is a biliopancreatic diversion with duodenal switch. We do not perform this surgery here. It only accounts for about 1% of all surgeries that are performed in the United States. We reserve these surgeries for academic centers. The next surgery that is still covered by insurance is the adjustable gastric band. We do not perform this surgery at Blessing because we do not recommend it. There are multiple issues associated with it, and its popularity has decreased significantly over the past 10 years. So what can you expect after surgery? Well, just like with any surgery, recovery takes time and patience. The diet is strict, but we will have educated you so that you will know what to expect and you will be ready for the dietary changes. You will experience some pain and discomfort, just like you would with any other surgery. The length of time to return to your normal activities will vary from person to person, and your healthcare team will advise you when you can resume your activities and go back to work. So what can you eat after surgery? Well, there are 5 different phases of dietary changes. The first phase will mainly be while you're in the hospital, and this will be sips of clear liquids. Then for the following 2 weeks, you'll be on sort of a full liquid diet, and we'll educate you very well as to what exactly that means. Phase 3 is more pureed foods. Once you're tolerating those, we will advance you to the phase 4 diet, which is still softer foods, but not necessarily pureed. And the phase 5 diet is really what you will be on for a lifetime. So after surgery, you need to consume anywhere between 60 to 90 grams of protein a day, and our dietitian will help you determine exactly how much you need. You will need to drink a minimum of 64 ounces of fluid every day, which doesn't sound like a lot, but can actually be difficult to obtain. You will have to avoid drinking with meals. Vitamin supplements are required, even with the sleeve gastrectomy. At least initially, you will want to avoid carbonation and alcohol. And generally, we do recommend that you avoid alcohol for the first year. So how much weight can you expect to lose? Well, after the vertical sleeve gastrectomy, you can expect to lose anywhere between 50 and 60% of what we term your excess body weight. So for someone who is 100 pounds overweight, which is about a BMI of 40, you can expect to lose anywhere between 50 and 60 pounds. And for the gastric bypass, you can expect to lose a little bit more, about 60 to 70% of your excess body weight. So for that same person that's 100 pounds overweight, they would expect to lose between 60 and 70 pounds. And so what are the benefits of weight loss surgery? When you lose weight, everything improves. Migraines are improved. Your risk of heart disease goes down. Your risk of stroke goes down. Your diabetes can either improve or completely resolve. Your risk of those 13 cancers we talked about goes down. There are significant benefits of weight loss surgery and weight loss in general. It is not all about appearances. There are also different psychological and psychosocial improvements after surgery and after weight loss. The studies have shown that people's self-esteem is improved. Your ability to go out and get a job is improved. There's multiple psychological benefits to being a healthy weight. Just imagine boosting your confidence, fitting comfortably into an airplane seat, being able to play with your kids, reducing or eliminating your need for medications. So what are the potential complications of surgery? I'm happy to report the complication rate and the mortality rate after weight loss surgery is actually less than that is for gallbladder surgery and for hip replacement surgery. The complications of this surgery are very similar to the complication of other surgeries. You do have a risk of developing a leak. There's a risk of developing blood clot in your legs or having a blood clot go to your lungs. There's risk of bleeding, infection, risk of hernias. There's risk of ulcers. The ulcer risk is a little bit higher in patients who have a gastric bypass. About a third of people will develop gallstones. So if you still have your gallbladder, we will give you medication to help prevent gallstone formation. You also have the risk of constipation. Nutritional deficiencies can be significant after weight loss surgery, which is why from the very beginning we have you take vitamins. Some people will develop reflux after a sleeve gastrectomy. Then there's a risk of bowel obstruction as well. Something else that I want to mention is dumping syndrome. So this is something that happens more so after gastric bypass and after a sleeve gastrectomy. But what happens is someone will ingest simple sugars, say like a candy bar, and then your body's response is it shifts some of the fluid from your blood into your intestine, and this can result in feelings of nausea, can even cause some issues with vomiting and diarrhea. And so this is avoidable just by simply avoiding sugar ingestion, but it is one of the more common symptoms that some people will have long term after gastric bypass. But in reality, it's not actually a bad thing because your whole goal of having the weight loss surgery was to lose weight. This is sort of a way that your body can help you avoid ingesting the foods that aren't healthy for you in the first place. So what are your next steps? You've completed the first step. You've listened to this seminar. The next step is to notify us so that we can get you started in the process and we can start obtaining your benefits information and your health information. And then we'll start walking you through all the various steps that we talked about earlier. I just wanted to present you with a few last minute facts. Did you know that you can actually turn your weight loss into a tax break? Back in 2002, the IRS designated obesity as a disease. That means that you can deduct some of your health expenses related to obesity from your taxes. The IRS states that once your healthcare expenditures exceed 10% of your adjusted gross income, then you can deduct those expenses. So you can deduct your dietitian visits and your weight loss surgery visits, in addition to other visits such as your routine dental visits and other medically related expenses. You can deduct those from your taxes. Some people will talk about weight regain after surgery. Well, the truth is, it's not really a well understood process. And although some people will regain weight after weight loss surgery, the vast majority of people lose the weight and maintain the weight loss. There are different reasons why we think this happens. Some of it is psychiatric related, which is why the mental health evaluation is so important before weight loss surgery. Some of it's going to be behavior and dietary issues, when people not really eating what they're supposed to eat. There can be different metabolic conditions such as undiagnosed and untreated thyroid disorders that can contribute to it as well. Failure to follow up after surgery and failure to attend support groups has also been shown as an independent factor for not having a successful weight loss after weight loss surgery. But like I said, the good news is most people do not regain weight after weight loss surgery. And according to the American Society of Metabolic and Bariatric Surgery, about 50% of patients will regain a small portion of the weight they lost, about 5%. But that means that most people maintain their weight loss. Surgery can help change your life. Remember, surgery is a tool that requires your strong commitment to a lifestyle change and a lifetime of follow-up. It is the healthy way out, not the easy way out. But remember, surgery can change your life. Thank you.